moving on to the next talk. It's Professor Harry Rutter. Harry is a Professor of Global Public Health at the University of Bath. He's also a member of the Strategic Council for the All-Party Parliamentary Group on Obesity, and his talk today is on the need for urgent action to reduce widening inequalities in childhood obesity. Thank you, Harry.
Thanks very much, Kath. Next slide, please. Hello, everyone. So my focus is not so directly on COVID-19. It's much more on the longer term ways in which obesity is playing out through the population because of what's going on in terms of obesity in childhood, and particularly the focus on inequalities. And I think the word inequalities is important. The word disparities is starting to creep back, and that worries me. It's a much more neutral term. I think we absolutely need to be talking about inequalities here. There are inequalities by age, there are inequalities by sex, there are, very importantly, inequalities by ethnicity, and of course there are inequalities by socioeconomic status. There are inequalities all over obesity, and unfortunately, in almost every case, they're getting worse. If we start by looking at what's happening to prevalence just of obesity by age and sex from the National Child Measurement Programme, as you can see, reception's been staying broadly level, but for year 6, among both boys and girls, since the first year of the National Child Measurement Programme, it has been steadily increasing. Next slide, please. If we look at what's been going on with severe obesity, particularly for year 6 boys, the picture is even worse, even more worrying. Next slide, please. I've been using versions of this slide since we first started collecting the child measurement data, and for me, this slide reflects one of the greatest disgraces in obesity in the country. What we see here is that not only does the prevalence of obesity double from the first to the last year of primary school, it more than doubles between the least deprived decile of children and the most deprived decile of children. If you could go on, please. This is even starker when we look at severe obesity, where there's a more than 4-fold range between the children in the least deprived decile and the most deprived 10% of children. We've got really this is a really astonishing picture. And if you go to the next slide, what we'll see is that it's getting worse. So this uses the slope index of inequality, which is a composite measure that looks not just at the difference between the most and the least deprived decile, but looks across the piece. And what we see here is that inequalities are widening. They're widening badly in reception and really quite shockingly in year 6. So we don't only have inequalities, we have inequalities that are getting worse. Could you move on, please? And of course, as I said earlier, there are inequalities by ethnicity. Ethnicity is very hard to measure here. The reference population against which the Child Measurement Programme data are compared come from, for various technical reasons, a purely white population. And what we end up with is a set of figures that, to some extent, misrepresent unavoidably the prevalence in different population groups, and almost certainly underreport the nature of the problem in children of South Asian origin. My colleague Mohammed Huda at St. George's has done some really fantastic work looking at correction factors for this. And when we apply it, we see some of these figures actually look even worse than they do already. Next slide, please. So this week we've seen the policy paper that is all about empowering adults and children to live healthier lives. This has been much trailed. There's been a lot of excitement about it. And there's some really good stuff in there. Could you move on, please? Next slide, please. We've got, at long last, long overdue, some really important work to reduce end promotions of unhealthy foods, restrict advertising, very importantly, not only on TV, which to some extent is at least partly missing the boat, but also really essentially restricting online advertising. But some of this stuff has been out for consultation for a long time, and it's still being consulted on. And correct me if I'm wrong, but I'm pretty sure it's not coming in until 2022. And as you've seen from those slides I've shown you, we have an emergency here. We can't wait until 2022. We've also, on Tuesday, saw some really, I think, some really positive indications about policies on physical activity environments, on active travel, where if local authorities are able to make the most of these opportunities, we could see a transformation in some parts of the country in terms of the quality, the safety, the availability of active travel infrastructure. So there's some really good stuff in there. And before I go any further, I'd like really to emphasize that I'm seriously impressed by the work that PHE and the Department of Health and Social Care have been doing for years, pushing these kinds of interventions, pushing these kinds of measures. Any criticism I have of what's going on is not a criticism here of either PHE or DH. My concerns relate to the political framing of this, the persistent focus on individual level responsibility, on interventions that require a high level of personal agency, on a misplaced focus on this concept of choice, as if we all have completely free choice without there being any constraints on those choice, ignoring the ways in which the environments within which we make those decisions are hugely framed by all sorts of considerations, many of them commercial. Sure, you can choose to eat healthily. Sure, you can choose to get plenty of physical activity, but the wealthier and the better educated you are, the easier those opportunities tend to be. And for many people, those opportunities are really hard to come by. So I think a focus on choice is a worrying focus, particularly when we look at inequalities. If you go to the next slide, I've got a very simple example of this from a really great paper by Jean Adams et al., the title of which really says it all. Why are some population interventions for diet and obesity more equitable and effective than others? And what they show here is the difference between an information campaign at the top, which requires multiple steps to go through from being given the information, assuming that knowledge deficit was the problem in the first place, through to the final step, in this case, of taking folic acid supplements, but it could be anything. Alternatively, one can adopt a structural intervention, in this case, adding folic acid to wheat flour at source, and you just don't have to go through those steps. So it doesn't require the same level of personal agency, and in general, those kinds of structural interventions are A, more effective, and B, much, much less likely to widen inequalities. Next slide, please. So in summary, we've had the Foresight report on obesity, came out in 2007. We've had well over a decade here knowing what's going on. Obesity is not a knowledge deficit problem. It's not fundamentally down to a lack of willpower. It's driven by obesogenic environments. And effective responses to obesity must address those kinds of structural factors. There are really severe inequalities in child obesity by both deprivation and ethnicity. They have been getting worse and they are continuing to get worse. This set of interventions that have been announced this week, they contain some really great stuff, but I think the focus on individual choice, on empowerment, on agentic interventions means they just don't go far enough. And I'm seriously concerned that unless the government really gets its act together here, it's going to end up making these inequalities worse, not better.